Get to know Encor Enspire breast biopsy system, setup, components, features and tools, cleanup. Before attaching the probe to the driver, put all of the accessories in place. Secure the lid onto the canister. Secure the large cap and tandem cap to the lid of the canister. Rotate the tray. Open the covers and place the canister into the console. Connect the yellow tube to the center of the canister lid. Insert the cassette. Notice the click that ensures proper insertion. Connect the large tubing of the cassette to the empty port on the canister. Connect the saline cassette tubing to the saline recipient and place it in its dedicated slot. Close the covers and rotate the tray to the standard position. The Encor Enspire status is displayed on the touch screen. The system is calibrated for stereotactic biopsy with a 10G needle. Advanced mode is selected. Sample pattern shows 6 samples. Samples are removed clockwise, even orientation. To rotate the aperture orientation to odd positions, touch the arrow buttons and select the desired start position. Basic, Advanced, and Fine Precision mode are available in the drop-down menu. Fine Precision allows a 12-sample pattern and is available only if enabled in the System Configuration screen. Dense mode consists of an increased aspiration and cutting time versus normal mode with the same vacuum power. Half notch is typically used for lesions that are located either very close to skin or very close to the breast support. The sample pattern can be customized as needed by simply pressing the desired sections to select, or touch and drag your finger through the desired area. Non-contiguous sections are not available in basic mode. Observe a full 12-sample pattern, even and odd sections, full notch, normal tissue. The sample count is displayed on the bottom right of the screen. Vacuum is done while sampling. Rinse is done automatically while sampling, 2 milliliters every 10 seconds as the default setting. The notch aperture status is shown during the sequence. Sample sections become blue when completed. Sampling can be paused and resumed at any time during the sequence, typically for extra vacuum, additional anesthesia, or tissue marker deployment when representative samples have already been obtained. Sampling is paused for extra vacuum. Press and hold the VAC button either on the foot pedal or the handpiece. The VAC menu is displayed on the screen. For manual VAC, keep pressing the VAC button and release to stop the vacuum. Observe the VAC indicator. For other VAC options, either hold or rotate in the sample screen. Press the desired option to activate and release the VAC button, then press again to stop. VAC options help in case of abundant bleeding. The rinse option is available to get extra saline to wash the samples. Adding anesthesia is possible at any time during the sampling sequence. Select the Anesthetic tab. The notch opens. Remove the basket rear cover. Connect the anesthesia syringe to the anesthetic adapter. Fill it with anesthesia to avoid entry of air into the breast and connect to the probe internal sheath. Press the 360-degree button so that the anesthesia is spread equally. When done, remove the anesthetic adapter. Press Sample to close the notch and come back to the Sample tab. Put the basket rear cover back in place. Alternatively, and following a non-full sample pattern, the same pattern can be selected for anesthesia if needed. The notch is opened at the center of the selected pattern, and the sweep, while injecting, is done around that area when the pattern button is pressed. Sampling can be resumed and stopped when representative tissue has already been taken. The use of a tissue marker is strongly recommended. To ensure that the correct area has been biopsied, identify biopsy site for immediate confirmation. Identify previous biopsy sites for follow-up activities. Select the Marker tab. Replace the basket rear cover with the marker adapter. And introduce the marker applicator through the probe internal sheath. Make sure the applicator yellow marker aligns with the red probe marker. Push the applicator firmly all the way to release and deploy the tissue marker in place. The tissue marker emerges through the notch and stays in the tissue. Once deployed, release your finger from the tissue marker applicator. Press the Rotate button on the screen. The notch will rotate 180 degrees to avoid pinching the tissue marker while closing the notch. To minimize migration, both the probe and tissue marker applicator are removed from the breast as one unit. Remove the probe from the driver. Remove the tissue marker applicator from the probe. Disconnect probe tubing, saline and fluids. Open covers. Disconnect tubing and remove the saline basket, cassette and canister. Dispose as appropriate. Close covers. Switch off Encor Enspire and disconnect the power cord from the AC outlet.